After the age of 50, your body begins a subtle but profound transformation. Processes that once worked automatically now ask for more care and attention. Metabolism slows down. Energy isn't as constant as before. Recovery takes longer, and the body starts sending quiet signals that it's changing. Hormone production decreases slowly but surely. For men, testosterone levels drop, influencing strength, mood, and motivation. For women, estrogen and progesterone decline, especially after menopause, impacting bone health, heart protection, and emotional stability. These internal shifts alter your body's composition. Muscle mass tends to decrease, while visceral fat, the hidden fat deep around your organs, increases, especially in the abdomen, and this type of fat isn't harmless. It acts like an organ itself, releasing inflammatory substances that can damage your arteries, your heart, and even your brain. When you add a sedentary lifestyle, poor diet, lack of sleep, and chronic stress, you create the perfect environment for what doctors call silent diseases. Conditions like type 2 diabetes, hypertension, hypothyroidism, and cardiovascular disorders, illnesses that grow quietly until it's too late. That's where preventive exams come in. They are not a burden. They are your window into what's happening inside your body long before symptoms appear. If you're over 50, a complete annual checkup is essential. Focus on these key tests: complete blood count, CBC, to detect anemia, infection, and immune strength, lipid profile, total cholesterol, HDL-LDL, and triglycerides to measure cardiovascular risk, fasting glucose and hemoglobin A1C to uncover insulin resistance and early diabetes, kidney and liver, function test creatinine, urea, AST, ALT, and gamma-GT to ensure your detox organs are working properly. But prevention is not just about numbers. Every result is a message, a signal. Learning to interpret those signals with awareness and intention can mean the difference between a long, healthy life and a late diagnosis. If you haven't done your exams this year, schedule them today. Don't wait for symptoms. Silence in your body doesn't always mean health. Sometimes it means warning. After 50, prevention becomes personal. Medical screening should be tailored not just to your age, but to your gender, genetics, and family history. For men, the most well-known and often most avoided exam is the prostate evaluation. It should be performed annually and includes two key steps: PSA, prostate-specific antigen, a blood test measuring the protein produced by the prostate. Digital rectal exam, done by a urologist to assess size, shape, and texture of the gland together. These exams can detect early-stage prostate cancer when treatment success rates exceed 90%. They can also identify benign prostatic hyperplasia, a common yet manageable condition. Other essential tests for men include abdominal ultrasound to monitor liver, kidneys, and bladder, electrocardiogram, ECG, and stress tests to catch arrhythmias or coronary issues early. And free and total testosterone levels, since andropause can bring fatigue, low libido, and mood changes. But prevention goes beyond exams. It's about choices. Balanced nutrition, regular exercise, and stress control form the foundation of true male longevity. Now, for women, around 50, most women are in menopause or nearing it. Hormonal shifts become powerful, affecting metabolism, bones, heart, and emotional health. These exams are fundamental mammography performed annually for early detection of breast cancer, pap smear and colposcopy to prevent cervical cancer, bone densitometry to measure bone density and detect osteoporosis, and a hormonal panel including estrogen, progesterone, FSH, and LH2 better manage menopausal symptoms and hormone balance for both men and women. The universal essentials after 50 include eye examination for early signs of glaucoma or macular degeneration, hearing test, since gradual hearing loss affects cognitive and social health, and colonoscopy, crucial for detecting and removing precancerous polyps. These tests are not just data points. They are life-saving opportunities, gateways to longevity, vitality, and independence. Every time you schedule one, you're not just checking your health, you're protecting your future. Medicine today is changing. It's no longer just about treating disease. It's about anticipating it, about recognizing that health is not the absence of illness, but the presence of balance. This is the essence of personalized prevention, understanding that every body is different. Your DNA, your environment, your stress, your habits, they all write your unique health story. Beyond the standard exams, deeper evaluations can offer powerful insights. Comprehensive cardiometabolic checkup with echocardiogram and carotid Doppler, especially for those with a family history of heart disease or stroke. Complete hormonal testing, including cortisol, DHEA, and thyroid function to map your body's stress and energy balance. Predictive genetic testing, identifying mutations that may increase risks for cancer, Alzheimer's, or heart disease, nutritional and gut microbiota analysis, revealing how your digestion and immunity influence overall vitality. After 50, the goal is no longer to react, it's to prepare, to live not just longer, but better with strength, clarity, and joy. Longevity is not about time, it's about quality. The freedom to move without pain, the energy to laugh, to love, to live fully. And it all begins with one simple decision: to take care of yourself today. If this message resonates with you, share it with someone who matters to you. One conversation, one reminder can save a life. Leave a comment and tell me, have you done your checkup this year? I'm Dr. Alice Johnson, and I'll personally answer your questions, guiding you toward better health and greater awareness. And always remember, the best time to care for your health was yesterday. The second best time is now. Your tomorrow depends on the decisions you make today. If this content helped or inspired you, like this video, subscribe to the channel, and activate notifications for weekly, science-based guidance on health, longevity, and prevention. Every week, I share trusted medical insights so you can live with more awareness, balance, and vitality. Take care of yourself. Your body is your greatest ally, your most precious asset, and it thanks you for every decision made with love, discipline, and responsibility.